Hello friends, I am Dr. Nitin Sampat, a consulting neurologist practicing in South Bombay and Andheri and attached to Breach Candy Hospital, Bhatia Hospital, Global Hospital and Elizabeth Hospital. I am in practice since about 30 years. Today I am going to discuss the diagnosis and do's and don'ts in epilepsy. Epilepsy, as you all know, is a fairly common condition, but there was always a myth that epileptics cannot do well in education and working. That is not true. If epilepsy is well controlled, then the people can live a normal life. To make the diagnosis of epilepsy early is very, very important. Now it's very easy when there is a generalized tonic-clonic fit. Anybody can say that this was definitely an epilepsy, especially if it's accompanied by passage of urine or tongue bite or injuries. However, it's the complex partial seizures or the petit mal seizures, the absence seizures, which are difficult to diagnose. For example, the absence seizures, you ask the child to start counting 1, 2, 3, 4, 5 and breathing deep, and suddenly he will stop counting and he will flutter his eyelids and then go on again. Or in a complex partial seizure, there may be what is called uncinate fits, where the patient might will be jumping his jaws like this way, and that also is a fit. Or he may just stare and then go on as if there's nothing has happened. Now this is regarding diagnosis. Of course, we should, besides an eyewitness account, we should resort to investigations like MRI and CT and EEG and so on. Once the patient is established an epileptic, the proper drug for that kind of epilepsy should be started and the level should be built up gradually. We may resort to serum levels if the fits are not well controlled, especially in the older drugs like phenytoin and carbamazepine and so on, and valproate, where they have a curvilinear kinetic. The new drugs have a linear kinetic and serum levels are not required. We usually take one drug appropriate to that type of epilepsy and build up the levels. If the fits are not controlled in spite of serum levels being achieved, then we introduce a second drug, build that up and take off the first one. If that also does not control the epilepsy, then we may have to give two drugs, either one old and one new, or two new drugs. Now once the diagnosis is established, what do we tell the patient, or what is to be avoided? What we should tell them is that they should sleep properly, get a proper sleep of 6 or 7 hours. They should not fast, because these are factors that can precipitate fits in a potential epileptic. Besides that, if any infection, fever, cough, cold, they should resort to their family doctor immediately, because that can also precipitate epilepsy. However, suppose the fit comes, then what should the family do? If there is an aura or there is a warning that the fit is coming, the patient should be made to sit or lie down there itself. Now one should not make an attempt to take him or her to the bedroom. The head should be turned to one side so that if the patient vomits, it's not aspirated and no pneumonia can occur. A wad of handkerchief should be put in the mouth so that tongue bite is avoided, but no fingers should be inserted in the mouth. So smelling of onions or chappals is a myth and should not be done in the 21st century. Then tight clothing should be loosened and the windows should be opened wide so that the breathing of the patient is not affected. And then the family doctor should be summoned, because if more than one fit occurs or a status epilepticus occurs, they can use injectables like lorazepam and things like that to control the epilepsy. All this is very, very important, otherwise the patient can sustain injuries, especially while going down the stairs or crossing the road. If they get a fit, they would sustain serious injuries. One must remember that even if this aura or warning comes in the form of a jerk, or the toothbrush flies out, then the patient should make it a point, or the relative should make it a point to make the patient sit down even on the footpath, so that they don't get injured. Another type of epilepsy which is often very missed by the relatives is myoclonic epilepsy. That means they get jerks like this. For example, there was a boy who was never given milk in a glass utensil because he used to break glasses. Till one day the family doctor was present and he saw that he dropped the milk in this way and not this way, and that was a myoclonic seizure where valproate is very good. So these do's and don'ts are very, very important for the epileptic patient, and the family should follow them. Of course, swimming, hiking and car driving is not allowed unless the seizures are completely controlled for a year or so, when driving can be allowed again. But swimming and hiking or working in professions where the involvement of the patient with big machines where they can harm themselves should be best avoided. I think if these conditions are followed and proper drugs are given, then epilepsy is easily controllable and the epileptic can lead a normal and fruitful life. Thank you very much.